Every year, thousands of men across America face a silent battle, one that rarely makes headlines, but can change lives in an instant. Prostate cancer, often called the silent threat, doesn't always announce itself with dramatic symptoms. Instead, it creeps in quietly, hiding behind everyday aches or subtle changes that are easy to dismiss or attribute to aging. For men over 60, this is a reality that can't be ignored. But what if by paying close attention and trusting your instincts, you could spot the warning signs early and give yourself the best chance at a healthier, longer life? Today, we're going to walk through the 8 warning signs of prostate cancer that you should never ignore. This isn't just another health checklist. It's about you, your family, your future, and taking control when it matters most. Let's start by acknowledging something important. Growing older is a gift, but it comes with its own set of challenges. You've weathered storms, celebrated milestones, and built a legacy. Your health, now more than ever, deserves your attention. Prostate cancer is one of the most common cancers among American men, particularly those over 60. Yet, too many men avoid talking about it or put off doctor visits, hoping discomfort will just go away. But knowledge, as they say, is power. And by arming yourself with the facts, you can catch this disease before it takes its toll. The first warning sign to watch for is changes in urinary habits. Maybe you've noticed that you're getting up more often at night to use the bathroom, or that it's suddenly harder to start or stop your stream. Perhaps you feel like your bladder is never quite empty, no matter how often you go. These might seem like minor annoyances, something to chuckle about with friends over coffee. But frequent urination, especially at night, difficulty starting or stopping urination, or a weak flow can all be early indicators that your prostate is enlarged or irritated. The prostate gland, which sits just below the bladder, surrounds the urethra, the tube through which urine passes. When the prostate becomes enlarged due to cancer or other conditions, it can press against the urethra, making urination more difficult. If you notice these changes, don't chalk them up to just getting older. It's your body's way of waving a red flag. Listen. The second warning sign is pain or burning during urination. Now, let's be honest, no one enjoys talking about pain down there, but it's crucial not to ignore it. Pain or burning while urinating is often associated with infections, but it can also signal something more serious, like prostate cancer. The discomfort might be mild or intermittent at first, but any pain in the pelvic or urinary area deserves attention. If you're experiencing this, especially if it doesn't resolve in a few days or comes back repeatedly, it's time to see your doctor. Don't let embarrassment keep you silent. Remember, your health and your future are too important to risk. The third sign is blood in your urine or semen. This is one of those symptoms that can be startling, a sudden streak of red where it shouldn't be. While there are several possible causes for blood in urine or semen, including infections or benign prostate conditions, it can also be an early warning sign of prostate cancer. Even if you only see blood once, don't wait to see if it happens again. Speak up, get checked. Early detection saves lives, but only if you take that first step. The fourth warning sign is erectile dysfunction or changes in sexual function. For many men, sexual health is closely tied to self-esteem and relationships. When things start to change in the bedroom, it can be frustrating or even frightening. Prostate cancer can interfere with the nerves and blood vessels that control erections. You might notice that it's harder to achieve or maintain an erection, or that your libido isn't what it used to be. While erectile dysfunction is common as men age and can have many causes, if these changes are sudden or getting worse, don't dismiss them. They could be a sign that something is affecting your prostate's normal function. Addressing this early not only protects your health, but can also lead to better outcomes for intimacy and quality of life. The fifth sign is pain or stiffness in the lower back, hips, or thighs. Prostate cancer doesn't always stay confined to the prostate. In more advanced cases, it can spread to nearby bones and tissues. This can cause persistent pain or stiffness in the lower back, hips, pelvis, or upper thighs, aches that might at first seem like typical aches and pains of aging or the result of an old injury. But if you notice new, unexplained pain that doesn't go away with rest or over-the-counter medication, take it seriously. Persistent bone pain, especially in these areas, is a red flag that needs prompt evaluation. The sixth warning sign is unintentional weight loss or loss of appetite. Has the number on the scale dropped without you trying? Are you finding that meals you once enjoyed no longer appeal to you? Cancer, including prostate cancer, can sometimes cause unexplained weight loss or a sudden decrease in appetite. This usually happens in more advanced stages, but it's a sign that should never be ignored. If you notice that you're losing weight without changing your diet or exercise routine, or if you're feeling weaker and more fatigued than usual, talk to your doctor. Your body is sending you a message. Don't let it go unheard. The seventh sign is swelling in the legs or feet. Prostate cancer, particularly in its later stages, can block lymph nodes or blood vessels in the pelvic area, leading to swelling in the legs, ankles, or feet. This swelling, called edema, can make shoes feel tight or cause discomfort and heaviness in your lower limbs. While swelling can also be caused by heart or kidney problems, it's important to get checked for all possible causes, especially if you have other symptoms on this list. The eighth and final warning sign is persistent fatigue. We all have days when we feel a bit more tired than usual, but if exhaustion becomes your new normal, it's time to take note. Prostate cancer can cause a constant feeling of tiredness, even after a full night's sleep. This fatigue can be physical, making you feel weak, or mental, affecting your focus and mood. It's easy to blame tiredness on age or a busy week, but persistent, unexplained fatigue should never be ignored. Now, you might be wondering, how do you separate these warning signs from the usual aches and changes that come with getting older? The answer lies in patterns and persistence. If you notice any of these symptoms sticking around for more than a week or two, or if they seem to be getting worse, don't wait, take action. Your instincts matter. No one knows your body better than you do. Beyond the physical symptoms, there's another side to this journey that often goes unspoken: the emotional toll. For many men, the idea of facing prostate cancer brings up feelings of fear, vulnerability, and even shame. You may worry about your independence, the impact on your loved ones, or the stigma of talking openly about men's health. But you are not alone. Millions of men have faced this path before you, and many have come out stronger on the other side because they chose to act early, to ask questions, to lean on their families and communities. Remember, early detection is the key to beating prostate cancer. When caught early, this disease is highly treatable, and the chances of a full recovery are excellent. Regular checkups, including PSA, prostate-specific antigen, tests, and digital rectal exams, are essential tools in catching prostate cancer before it spreads. If you're over 60, talk to your doctor about your risk factors and whether screening is right for you. If you have a family history of prostate cancer or are African American, your risk may be higher and screening may be recommended even earlier. It's also important to remember that not all changes to the prostate mean cancer. In fact, the vast majority of prostate issues are benign, such as benign prostatic hyperplasia, BPH, or infections. But because the symptoms can overlap, only your doctor can tell for sure. Don't diagnose yourself, and don't let fear keep you from seeking answers. Let's talk for a moment about the role of loved ones. If you have a father, brother, husband, or friend over 60, share this information with them. Encourage the men in your life to pay attention to their bodies, to speak up about changes, and to see their doctor regularly. Conversations about men's health can be tough, but they are essential. You could be the reason someone you care about catches prostate cancer early and gets the help they need. Looking after your prostate health isn't just about avoiding cancer, it's about living your best life. Staying active, eating a balanced diet rich in fruits, vegetables, and whole grains, maintaining a healthy weight, and avoiding tobacco are all proven ways to lower your risk. And don't forget the importance of regular checkups. Your doctor is your partner in health. Work together to create a plan that's right for you. As we close, I want you to remember this: your life is precious. You've spent decades building memories, relationships, and a future for yourself and those you love. Don't let something as treatable as prostate cancer steal that away. If you've recognized any of these 8 warning signs in yourself, don't wait. Make the call. Set up the appointment. Have the conversation. You owe it to yourself and to those who care about you. Let's quickly recap those 8 warning signs you should never ignore: changes in urinary habits, pain or burning during urination, blood in urine or semen, erectile dysfunction, or changes in sexual function, pain or stiffness in the lower back, hips, or thighs, unexplained weight loss or loss of appetite, swelling in the legs or feet, and persistent fatigue. Each one is your body's way of asking for help. Listen, respond, and take action. If this message resonated with you, or if you know someone who needs to hear it, don't keep it to yourself. Share this information with your friends, your family, and your community. The more we talk about prostate health, the more lives we can save together. Leave a comment below with your thoughts or questions. I read every one, and your story could help someone else find the courage to get checked. Don't forget to subscribe for more vital health information and share this with the men you care about most. Your voice, your action, could make all the difference. Together, let's break the silence, raise awareness, and protect the health and future of men everywhere.